Okay, so we want to talk about the low back, both from a performance and rehabilitation point of view. What do we do here at Lift Clinic to help out our performance and rehabilitation clients? The first thing is talking about our approach. We like to start by thinking about why are we here? Why is this important to you? And really what's most important to you in your life? What would you be doing if you were at 100%? And then as well as like, how is this affecting you day to day? From there, we're thinking about what's the cause of your pain. So we're going to go into some assessment and we're going to start to look at how you're moving. We want to understand how the low back fits in the bigger picture in relation to your whole body. And we maybe want to look at an anatomical diagnosis like you would find on the internet, but we also want to really be thinking about your movement patterns and how this kind of fits in there. So why is that area becoming painful? From a treatment point of view, we've got physio, chiro, massage therapy. We have a network of professionals, and including strength coaches that we work with closely. And so each one can kind of contribute a little bit. We try to do a fair bit of communication, collaboration, and networking so we understand how each other works. No matter who you come and see, we're in a position to be able to kind of say, hey, this is really going to benefit from this skill set, and kind of put you in a place where you get off to a good start with somebody else that's kind of like already understanding your situation and collaborating in your care. From a performance point of view, we're thinking about run, jump, train, play, those kind of things. We're thinking, how does this area fit in? It's so important. This is like the communication box for your lower extremities. So everything that all the messages are being communicated from your brain about what you want to be doing is coming through your low back. If the low back is sensitive and grumpy, you're going to have sensitive, grumpy muscles down here, or maybe tension or weakness that's undermining your performance. So it's really critical that we can kind of improve the health of the core and low back area in order to give you your optimal performance. We have a good example where we had one client that came in who'd hurt his back deadlifting. With a bit of treatment, we had a little bit of a multidisciplinary approach. We were able to find he had some weakness in his hip flexors. He had some limitations in his spinal flexion movement. And so we kind of were able to deal with those things. We got his symptoms down. We did a little bit of coaching on how to strengthen those hip flexor muscles, as well as how to specifically engage his full core. He got over his pain. He went back to his craft, his deadlifting. And about a month later, he hit a personal best, which was saying a lot because this is a guy who'd been lifting for about 15 years. So just being able to kind of tie all those elements together. So those are give you some ideas about how we approach low back pain. Hopefully that'll be helpful to you.